You hit the gym, clean up your diet and see results, except for your chest. No matter how hard you work, there's a persistent puffiness that just won't budge. It's frustrating and isolating, making you want to hide under loose shirts or skip the pool. You're not alone, countless men and boys deal with this, often thinking it's just stubborn fat. But what if it's not fat at all? What if there's a scientific reason? This is about biology, not willpower. That chest puffiness might be gynecomastia, a common, often misunderstood condition. It's not a sign of poor fitness, but a response to hormonal shifts beyond your control. Millions experience it, from athletes to everyday guys. The silence around it makes it seem rare, but it's incredibly common. Let's talk about it openly, without shame. We'll break down what gynecomastia is, why it happens, and what you can do. Forget the myths. Let's get real about what's going on with your chest. By the end, you'll have the knowledge to understand your body and seek the right help. Let's dive in. Gynecomastia is the growth of excess male breast gland tissue, not just fat. Men have breast tissue too, but it's usually minimal and unnoticed. Sometimes hormones trigger this tissue to grow. It's not about your diet or workout, it's a biological process. The main culprit? Hormonal imbalance between testosterone and estrogen. Everyone has both hormones, but in men, testosterone usually keeps estrogen in check. When this balance tips, testosterone drops or estrogen rises, breast tissue can grow. This is common during puberty when hormones are in flux. Up to 70% of boys experience temporary gynecomastia, which usually resolves itself. It's also seen in newborns and older men as hormone levels shift. For most, it's temporary, but sometimes it sticks around or appears outside these stages. Persistent gynecomastia can cause both physical and emotional discomfort. Remember, it's a medical condition, not a personal failure. Understanding the biology shifts the blame from you to your hormones, and that's something you can address. So, what throws your hormones off balance? Medications are a big factor. Anabolic steroids, some antidepressants, blood pressure meds, and even certain antibiotics can trigger gynecomastia. Recreational drugs like marijuana and heavy alcohol use can also play a role, often by affecting liver function, which helps regulate hormones. Even some personal care products, like those with lavender or tea tree oil, may have weak estrogen-like effects if used heavily. Underlying health issues, such as kidney failure, testicular or adrenal tumors, and thyroid problems, can also be triggers. Sometimes, gynecomastia is a sign that something else in your body needs attention. That's why it's important not to ignore persistent changes. Identifying the cause is key. Sometimes it's as simple as switching a medication, other times it's more complex. The first step is always to investigate the why. Don't self-diagnose. Get a professional opinion. Knowing the trigger helps you and your doctor find the right solution. Take action early for the best results. Is it gynecomastia or just chest fat? Pseudogynecomastia. Pseudogynecomastia is simply fat in the chest, common in overweight men, and feels soft and uniform. True gynecomastia is a firm, rubbery lump under the nipple. Sometimes tender, sometimes on one or both sides. Here's a quick self-check. Lie on your back, pinch around your nipple. A firm, disc-like mass suggests gynecomastia. Soft, even tissue points to fat. Self-checks are helpful, but not a substitute for a doctor's diagnosis. A doctor can confirm with an exam, blood tests, or an ultrasound. Why does it matter? Because treatment is different. One is hormonal, the other is about fat loss. Don't guess, get it checked. The right diagnosis leads to the right solution. Take the step to know for sure your health is worth it. Once you know what you're dealing with, you can act. If a medication or substance is the cause, your doctor may recommend stopping or switching it. For hormone imbalances, treatments like testosterone therapy or estrogen blockers may help. If it's due to an underlying health issue, treating that comes first. For pseudogynecomastia, focus on diet and exercise to reduce fat and build muscle. Long-standing gynecomastia may require surgery to remove glandular tissue. An effective, permanent solution. There's no shame in seeking help. This is a medical issue, not a flaw. Talk to a healthcare professional and take control of your health. Solutions exist and you don't have to live with discomfort or self-consciousness. Help is out there and confidence is within reach. Take the first step today.